Innovations in Value-Based Delivery, featuring Dr. Sri Shakaturu, Senior Vice President at CVS Health and Chief Medical Officer of CVS Caremark. Dr. Karen DeSalvo, Chief Health Officer at Google. Dedi Gilad, Chief Executive Officer and co-founder of TytoCare. Dr. Richard Milani, Chief Clinical Transformation Officer and Vice Chairman of the Department of Cardiology at Ochsner Health. And your moderator, Dr. Julian Harris, Chairman and Chief Executive Officer at Concerto Care and partner at Deerfield.
Welcome. We're really excited to have a phenomenal panel today to talk about the impact of COVID-19 on accelerating a range of changes from a value-based care perspective and a technology and innovation perspective. You had a chance to hear a bit about the panel in the tee-up, but I'd like to have each of them actually introduce themselves and give a bit more color on their roles and the ways that they impact the value-based care ecosystem. And we'll start with Dr. Chaguturu.
Thank you, Dr. Harris. It's really a pleasure to be here and be part of the Value Summit. So my name is Sri Chaguturu. I'm the Chief Medical Officer of CVS Caremark, which is the pharmacy benefit manager of CVS Health, where we serve 100 million lives and providing cost-efficient and quality access to pharmaceutical care.
Julian, it's great to see you and everybody else. I have a role at Google. I'm the Chief Health Officer, and my team guides Google to create exceptional products and services.
Thanks, Julian, and thank you for inviting me to this. My name is Richard Milani. I am the Chief Clinical Transformation Officer and the head of our innovation unit, Innovation Ochsner, at Ochsner Health System here based in New Orleans. My role is to try and help to look for gaps in care or look for better ways that we can deliver care in a more efficient, economical way that's going to impact populations both near and far.
Thank you, Julian, and thank you for having me. I'm Dedi Gilad, CEO of TytoCare, and TytoCare is really bringing, I think for the first time, a holistic solution to really allow better primary care at home.
And I'm Julian Harris, the CEO of Concerto Care, which is a company that focuses on providing an integrated model of care for seniors and adults who have complex health conditions across their medical, behavioral, and unmet social needs. So let's dive in, and we'll begin with you, Sri. Can you talk a bit about the impact of COVID-19 in promoting innovation and breaking down barriers to adoption of new technology?
Julian, thanks for the question. And, there's been a lot of ink spilled around this question, a lot of discussion around how has COVID-19 transformed how we do our jobs or how our corporations or healthcare systems have improved the way that we serve the patients, the customers and members that we have.
Dedi, can you talk a bit about your experience in terms of product adoption in this time, and particularly at the later stages of the pandemic?
Sure, Julian. So what we've encountered and saw in the industry is really an overnight change. There was obviously a massive jump into on-demand services. Consumers didn't have the options, and we found out that many of the provider groups that support digital front gate were not really ready for that. On one side, the clinics themselves and services were a little bit or a lot with less of demand, and many of the services shifted to digital.
Karen, as you think about Google and the impact that you all seek to have in healthcare, what do you think are the biggest opportunities for impact at scale?
I want to build upon a couple of themes that have already started around what people learned in the pandemic, and also this idea that health is more than healthcare. Maybe I'll start there and then segue to pandemic, which is, for us philosophically, we firmly believe that in order to drive health around the world, to have an impact, that it's not only about improving tools and capabilities in the healthcare environment. So what can we help caregivers have at their disposal? We also need to make sure that consumers have the information and the tools that they need to be healthy, and that we're doing all we can to address context, because I think as most everybody on this call knows, and I suspect a lot in the audience, health is driven by factors outside of healthcare, maybe as much as 60 to 80%. And so
the others on this panel and in the audience are doing in terms of data analytics. So but let's talk about some specifics. So one is a program that we call Next Best Actions. What we're doing is we're using our understanding of patients as consumers about what matters to them.
Well, we'll have to end on that note. And I want to thank our panelists, Sri, Karen, Dedi, Richard, for your thought-provoking comments. And thanks, everyone.